Hello friends and colleagues, I am Dr. Colonel Manas Chatterjee. I am Senior Advisor, Professor and Head of the Department of Dermatology at the INHS Ashwini at Mumbai. Today I am going to talk to you about the safety of bilastine in the management of chronic urticaria. Allergic diseases are common among the general population. Among these, urticaria, and specifically chronic urticaria, is likely to affect up to 20% of the population during their lifetime. Often associated with pruritic wheal and flare reaction, which may be associated with angioedema, it can also cause pain in some patients. Factors triggering the onset of urticaria can be identified in some, but the disease is idiopathic in 50 to 80% of all cases. Through this understanding, our best option to manage this condition is to avoid unidentifiable triggers, but mainly to counter the allergic pathophysiology of urticaria using antihistamines. While all international guidelines recommend non-sedating second-generation antihistamines as first line of treatment for urticaria, it's difficult to select the ideal one, as the commonly prescribed ones lack efficacy, for which we need to add or updose current available antihistamines according to patient profiles. So today I would be talking upon bilastine, which is a new second generation H1 antihistamine with an ideal antihistamine characteristic which is recently launched in India. Bilastine has been approved in more than 100 countries globally and have decentralized approval in 28 European countries, with large extensive clinical data studies conducted on more than 5,000 individuals with more than 22 million patients using bilastine worldwide. Bilastine is considered as a first choice antihistamine among Asian Pacific, that is APAC physicians. ARIA recommends bilastine as the highest scoring antihistamine among all other second generation antihistamines, and this is the only one to achieve a perfect 10 in the antihistamine scorecard. In India, it has been approved for the symptomatic treatment of allergic rhinitis and chronic urticaria in patients older than 12 years of age. APAC review on the selection of optimal second generation antihistamines for urticaria in Asia has also given its support to bilastine safety. Bilastine's robust clinical assays and studies in healthy volunteers to the actual accumulated clinical experience, bilastine has a profile of adverse effects similar to that of placebo and does not appear to significantly influence cardiac conduction, alertness, or driving ability, even in doses up to 40 milligrams. When it comes to efficacy, bilastine has high specificity for the H1 receptors, that is 3 and 6 times higher than for cetirizine and fexofenadine respectively. It has rapid and sustained action with the 8-hour duration of maximum effect and significant activity for at least 24 hours following a single dose, which makes it an ideal choice among other second generation antihistamines. Bilastine is an ideal antihistamine for updosing in difficult to treat urticaria as recommended by the EAACI and Galen and EDF and WHO guidelines for the management of urticaria. Bilastine has a Tmax of 1.13 hours, while the absolute bioavailability is 61%. Its half-life is estimated at 14.53 hours, while the published values for cetirizine and levocetirizine is about 8 to 10 hours. As a clinician, I'd look forward to using bilastine as it checks almost all the boxes for the qualities needed in an almost ideal antihistamine. Bilastine has been acknowledged for use by guidelines such as ARIA, and this is the only one which has achieved perfect 10 in the antihistamine scorecard and has also been scrutinized to become the first choice antihistamine among Asia Pacific, that is APAC physicians.